My name is Matt Beisel. I am a pastor and the lead director of adult discipleship here at Church of the Resurrection. And on behalf of everyone here, I would like to welcome you here tonight. Whether you are joining us here in person, or if you are joining us online for the live stream, or if you happen to be joining us on Pastor Adam Hamilton's Facebook page for this Tuesday night Vespers, I would like to welcome you into this space. This is a space of conversation, a space of dialogue, as we continue to seek a pathway forward, navigating the unique challenges of the COVID-19 pandemic. As we continue, I also want to draw some special attention to and give a special thanks to the UMW, the United Methodist Women, who responded to a nudge and created this space for this conversation here tonight. They are also our ushers, and so if you need help navigating this space, they are here to help. And they will also be here available afterwards if you have any questions. They would love to answer those for you as well. I would also like to draw your attention to our panel of medical experts and health experts who have given their time tonight. Thank you for being here with us and leading us and guiding us in this conversation. And before I introduce tonight's moderator, I would like to invite you to join me as we pause for a moment in prayer. Shall we pray? A loving and gracious God, we just take this moment to pause, to be mindful of you, to be grateful, to give thanks, to praise you. We are reminded by the psalmist that though the mountains crumble and the waters rage, you are our rock and our Redeemer, and that you call us into your redemptive work, calling us to be your hands and your feet. God, tonight we lift up especially those who are on the front lines of the COVID-19 pandemic. The road has been long. Continue to give them strength and empower them with your wisdom. And tonight, I pray that you send your Holy Spirit to be here with us in this conversation. Open up our hearts and our minds so that we may hear each other, so that we may better know each other, love one another, and care for each other. God, send your Spirit before us as we continue to seek a pathway forward. In Jesus' name we pray, amen. Well, I would like to introduce to you the Reverend Dr. Mark Holland, former mayor of Kansas City, Kansas. He will be our moderator and guiding us in discussion tonight. Thank you.
Thank you, Pastor, and thank you to the United Methodist Women and to the United Methodist Church of the Resurrection for hosting this event. It's an important conversation. As I was getting ready the last week and kind of preparing for this, I've just been very mindful about the weight of what we're doing and the importance of what we're doing. And so, of course, I wore my Kansas City shirt, my Royal shirt, in part to honor Salvador Perez becoming the all-time single-season home run king in Major League Baseball for catchers, yes. But also remembering 2014 and 15 with the World Series run and then the World Series win and the parade, and seeing Kansas City at its best coming together, really coming together as one. And then again, when the Chiefs won the championship, coming together as one. I was also reflecting on just this last week, we celebrated or remembered, celebrate is the wrong word, but we remembered the 20th anniversary of 9/11. And how in the midst of that great tragedy and evil and attack on our country really came together as one. And so I'm thinking about these times when our community and our nation have come together, and now here we are in the midst of a global pandemic, health crisis, and our community and our nation couldn't be more divided. And so my hope for tonight is that we have an opportunity to reset, we have an opportunity to take a deep breath, and we have an opportunity to come together again around the power of knowledge and the power of hope, to hear a message today about what we can do, some tangible things that we can do. So I really want to thank our esteemed panel for being here and for bringing that message of knowledge and hope for us tonight about what we can do. So I'm going to share their name and title, and then I'll invite each of them to come up and share a few minutes initial presentation, and then after those, we'll have some question and answer from the many questions that have been submitted for us. So I would like to welcome in the first chair here is Elizabeth Holshoe. She is the Epidemiology Director of Johnson County Department of Health and Environment. Welcome. Appreciate your being here. I also want to welcome Dr. Dana Hawkinson, the Medical Director of Infection Prevention at KU Medical Center. Welcome. And to welcome Dr. Angela Myers, Division Director of Infectious Diseases at Children's Mercy. And Dr. Richard Nobles, PhD Clinical Psychologist at Truman Medical Center. So with that, I'll ask Elizabeth Holshoe to come up and start us off with her opening comments. Thank you.
Good evening, everyone. First, let me say thank you so much for inviting me here. I'm absolutely honored to be among what a wonderful group of panelists. So first, my title is a little bit different, probably not quite as self-explanatory as the esteemed doctors that I get to sit up here with. So first, let me tell you what it is that I do, what an epidemiologist is. Most of you probably have never even heard of the name or the title prior to the pandemic, maybe until the New York Times declared us rock stars in March of 2020, which is unfortunately no longer a title I think most of us would be deemed with from the citizens of our communities. Epidemiologists are simply people who use data to study disease in the population. Some people study infectious diseases like COVID-19 or measles or pertussis. Other people study mental health or suicide, housing, and a number of other things that impact our health. I am very fortunate to work at the Johnson County Department of Health and Environment, where I've been for about 6.5 years and have gotten to know this community and care deeply for it. And I think when COVID-19 hit our community in March of 2020, I was in a unique position to understand our community, understand what they were already struggling with, and understand the unique impacts that COVID-19 was gonna have on us. Now, if you had asked me in March of 2020 if I thought 18 months later we would still be having these conversations, I'd still be talking about COVID-19, I never would have imagined. And much like all of you, I am also completely exhausted from it. COVID-19 has tested us as individuals, as families, as community members, as neighbors, in ways that we never could have imagined. And what we have seen is some of the best and honestly some of the worst, I think, of our neighbors. But what we are doing as we move forward and step by step is learning how to get through this. And at this point, 18 months in, it all is not lost, right? We have incredibly, incredibly effective vaccines that have prevented a large majority of our population from getting severely sick, ending up in their hospitals and dying. We are on the verge of hopefully having a vaccine for our 5 to 11-year-olds, which my 4-year-old turns 5 in November, and I'm counting down the days for it every day. But we are doing well as a community. Johnson County has a tremendously high vaccine rate, particularly for the region and the metro area in particular. But unfortunately, we don't have borders on our walls. We live in a community with people who travel, who have low vaccine rates, and we continue to see COVID-19 plague our community members. And right now, particularly those who are unvaccinated, which includes all of our children under the age of 12. In the past 18 months, a large proportion of my job has been working with our school districts. I think that nothing is more important than our children being in school and learning, as that's where we know they are the best off in terms of their education and their future. But right now, what we're seeing is in some schools around the community, infections having really high rates. But here's the thing, 18 months into COVID-19 pandemic, we actually know the things that work. We have, as I said, extremely effective vaccines. I love to see everybody wearing masks in the room. I know that at the beginning, we weren't really sure how well masks would work against COVID-19. What we have shown over and over and over again, including in our classrooms, is that they are very, very effective at preventing transmission. And we know more about the disease now than we've ever known before. What concerns me as we move forward is the fact that we're still continuing to have people who are resistant to getting the vaccine. And we're also seeing in countries around the world that they don't have access to that vaccine. And what that means is that there's more opportunities for this virus to replicate, to infect people, and to potentially mutate. I know later on we'll be talking about the Delta variant, which is the current variant that's affecting our community and communities all over the world. And what it's gonna take for us to not have another variant that comes in and attacks our community and makes our family members and our relatives and our neighbors sick is for as many people as possible to get vaccinated. So if you have people in your life that have not been vaccinated yet, I would strongly recommend you have a conversation with them. When the vaccines came out over the last winter, I was a big proponent that you should not judge people for not getting it. There's a lot of reasons why people don't get the vaccine. Misinformation runs rampant. And if they're concerned, I would strongly recommend they reach out to their physicians. The physicians that know them, that have treated their conditions, who have watched them as they have had children, as they have dealt with diagnoses. Those are the people who can talk to them and explain to them the benefits and dispel some of that misinformation around vaccines. To me, it is truly a miracle that in about a year's time from when we first learned about COVID-19 to when we had not just one, but 2 very, very effective vaccines come out, that is a miracle to me. I think a lot about the parable of the gentleman who was drowning and called out to God for somebody to come and for him to rescue him and save him. And he sent a boat, and the gentleman said, "I'm waiting for God." And they sent a helicopter, right? And again, he had these opportunities to be saved. And he declined them every time. And when he died and got to the pearly gates, he asked Jesus, "Why? Why didn't you save me?" And he said, "I sent you all of these things to save you." To me, that is the vaccine. So as we move forward, I think that we need to continue to work with our community members, try and dispel this misinformation, and that's the way that we'll move forward and get back to the normal that we all desperately want to get back to. So with that, I appreciate the time. Thank you very much, and I look forward to the questions.
Thank you very much. Next, we'll ask Dr. Dana Hawkinson to come up and share.
All right, thank you. Dana Hawkinson, and just a brief thing about me, because that is what got me to where I am today and what I do today on a daily basis. So I did undergraduate in biology. I did graduate school at the University of Kansas in microbiology. I always knew I wanted to work with microorganisms, things that could do you harm or even potentially kill you. So I actually, after graduate school, I did do a civil service. I worked for the Kansas City, Missouri Public Health Department in infectious disease investigation, doing a lot of that, getting to know Kansas City, going on the streets, doing tuberculosis investigation, hepatitis A, other infectious diseases. After that, I went to the University of Kansas Medical Center for medical school. I did residency and fellowship. Became an infectious disease physician, and then about 5 years ago, I took the position of medical director for infection prevention and control and work with a great team of thoughtful, conscientious nurses working to protect you and your family from reducing the risk of things like hospital-acquired pneumonia and other infections you can get and other complications you can get in the hospital. And we have one of them here tonight, Tiffany. They have taught me a lot. But the worst thing I ever had to deal with before COVID was maybe an interview once or twice a year, maybe once a year for influenza, and then once a year for tick-borne diseases. And heaven forbid, do you remember oak mites? We were doing actual interviews for oak mites. Why can't we get back to that now? So, but obviously now my role has changed, and it started with the first amount of information that we had, which wasn't a lot. And it's continued on from there. And I think certainly as we heard Elizabeth talk about the misinformation, and a lot of my role now has pivoted to not only patient care, because that's what I was really wanting to do was individual patient care, but now it is more of the medical and science communication, and it's trying to present those difficult topics for most people, those medical topics, to them in a way that they can understand. It is also trying to debunk those myths or talk about the truth about what is going on about certain aspects, because it can get confusing. And I know for me it has gotten confusing as far as the CDC will say you need to continue to mask and then you don't. Okay, we understand that there is more information, so this is why we are doing what we are doing. And then it was these vaccines are working. They give good protection, but now we need boosters. And as soon as I saw that headline, my head just dipped because I knew the questions we would be getting. Because these are topics that nobody really has had to deal with before if you don't work in medicine. Things go on. You know about all the drugs that have come out. You know about all the vaccines that come out. Nobody was watching day to day to see what is the updated news of these vaccine and these drugs trials. And so we have had to continue to ingest and take in so much information and relay that to you because there is so much information out there to relay to you. And it is a trouble about finding, seeking the truth sources, and what are they? So I think, we start with the people that want to do their own research. Well, all of this information is out there, and it's publicly available, and it has been for a year. And so I don't know how much more information there is, but there are still some people who really are susceptible to misinformation, either by digital means or print means. And so it really is incumbent upon us to continue to give the message of this is what we have. Our knowledge 2 weeks ago is different than our knowledge today. This is what we are doing. These things are not true about this aspect of the disease or this aspect of the vaccine. So I've really pivoted on what I've done this past year. One, to continue to take in as much information as I can, whether it's podcasts or journal articles or news articles, and then try to relate that to the general public so that they can understand what is the source of truth and what is going to, more importantly, what is going to protect you, your family, your loved ones, and your community. And so that continues to be a struggle. But we will continue to do it because we know what the truth messages are. We will continue to give you and give really everybody that can listen and wants to listen the messages of truth, what are the accurate messages, so that we can get through this pandemic. We do have a way out. As we heard from Elizabeth, we know the way out. It is through vaccination. It is through those other non-pharmaceutical means that we're doing too, masking, distancing, especially in those times of high risk and high prevalence. But we just have to keep giving that message, endorsing that message, because that is the way that we will keep ourselves safe, our loved ones safe, our community, our nation, and our world. So, thank you.
I just want to say, we had those oak mites, and they were terrible. So I'm gonna talk to you a little bit more about that afterwards. Dr. Angela Myers, welcome.
Thank you for having me tonight. So they did give a little bit about their past, so I'll give a little bit about my history too. I was born and raised here. I've grown up here in Kansas City my entire life, and I grew up in the United Methodist Church. I was married at Old Mission over on Shawnee Mission Parkway, and I'm a member of St. Paul's, which is in Lenexa. So I've been a Methodist girl my whole life. I went to Shawnee Mission South High School and then went to UMKC's 6-year program for undergrad and medical school. And then stayed here and did my pediatric residency at Children's Mercy and then completed my pediatric infectious diseases fellowship at Children's Mercy while also getting a master's in public health at University of Kansas. Huge Jayhawk fan, even though I didn't go to school there except for my master's. I have been at Mercy now for 20 years, including all of my training. So I have a huge love for Children's Mercy. I have a huge love for children and children's health and for what Children's Mercy can do for the community and for the Kansas City community in general. So I wanted to share with you a little bit about what we've been seeing. You know, things have really changed over this last year and a half, as both Elizabeth and Dr. Hawkinson mentioned. You know, early on in the pandemic, we weren't seeing a lot of cases here, but we were seeing a ton on the East Coast and on the West Coast, especially in Washington State and California. And initially, it looked like kids were largely unaffected, or the rate in which kids were getting infected was so much less than it was for adults. And so that wasn't really thought as concerning for kids. And early on, kids didn't get as many infections and they didn't get as sick. But some things changed over the course of this past year and a half that we need to keep in mind. And Dr. Hawkinson mentioned how the data has changed, and the data has changed rapidly over this last year and a half, and it's really hard to keep up with it. And if you saw those slides before we started talking, you saw that little girl trying to drink from a firing hose. And that is what it feels like, I'm sure, to you all, and it also is what it feels like to us as we try to absorb all the new information coming in. But a lot of people have asked me this question, and so I wanted to talk about it a little bit tonight. So a lot of things happened all at once. We have a vaccine now for adults, and we got adults vaccinated fairly quickly across the United States, in some instances not quickly enough, but I think we overall did a pretty good job. And that was wonderful, and the vaccines are very effective, but we left a huge portion of the population unprotected, children. In the midst of that, we had a variant that started, if you remember, the Alpha variant, which peaked in March-ish, which was a little bit more contagious than the original strain that we saw. Shortly after that, we started seeing concerning signs of another variant, or the Delta variant. And the Delta variant turned out to be far more contagious than the previous two strains. So that put us in a position of having a large portion of population that were too young to be vaccinated, and a portion of teenagers who now could be vaccinated starting in May of this year that weren't yet vaccinated, with a virus that now causes every infected person to transmit to 5 people rather than the original 2. And if you think about the exponential growth of a virus, which people have talked a lot about, if I infect 5 people and those 5 people infect 5 people, you can see how quickly it spreads and grows. So we have a big population of kids unvaccinated. We've got a much more contagious virus that's starting to take a foothold right at the time where cases are going down initially, and we think we can stop wearing masks and we can start being together and we can kind of get back to normal life, which everybody was really, really ready for at the beginning of this summer, because everybody was exhausted coming through this past year. But then what happened was we started seeing a bunch of cases in kids. And starting right after the 4th of July, Children's Mercy started seeing just kid after kid after kid test positive. And what we saw was this huge increase in hospitalizations. And we've seen kids in the ICU, and we've seen kids in our neonatal ICU, and we've just seen a huge increase in cases, and we're still seeing a huge number of cases. The case numbers have gone down a little bit in the last couple of weeks, but we're still seeing a big preponderance of cases. And people say things to me like, well, but it's only the kids that have underlying conditions that are in the hospital, or it's only the kids who are immune compromised. And you know what? That's not true. I was on service last week, healthy 17-year-old boy, very fit and in shape, an athlete, in the ICU on 20 liters of oxygen from COVID. 20 liters. That's a lot. He was very sick. We are seeing kids who get sick, and we are seeing healthy kids who get sick. It's not just kids with underlying conditions. So when the announcement was made this week that there's going to be a vaccine soon for 5 to 11-year-olds, I was overjoyed. I am so excited. I am counting down those days with Elizabeth. I cannot wait till we can get younger kids vaccinated and get them protected. Because frankly, I love kids. I love all kids, but I don't love seeing them in our ICU. Thanks.
Thank you. And now we have Dr. Richard Nobles. Please come forward. Thank you.
Well, that's one way to start. I'd like to thank the Church of the Resurrection for having me here tonight, and I will start by, as everyone else has, telling you just a little bit about myself. I'm not from here. I'm from a little bit of everywhere. I did my undergraduate at Yale University. I did my PhD at the University of Washington, did an internship at Hennepin County Medical Center in Minneapolis, did a postdoc in Portland, Oregon, did a postdoc here in Kansas City, and that's how I wound up at Truman Medical Centers. And I've been there for the last 2 weeks ago, 9 years. And I will, in fact, be moving on to KU Medical Center next week. So, but that's very kind of you. I am a child and adolescent clinical psychologist by trade, and I specialize in anxiety disorders. And one could imagine what it is like to be a child and adolescent clinical psychologist who specializes in anxiety disorders right now. And for the last year and a half, I will tell you, it has not been the most enjoyable experience watching these children and these teenagers, and I specialize in teens specifically, watching these teenagers come in virtually with panic, with significant generalized anxiety, which is something that is typically more on set in early adulthood. Kids coming in with symptoms that might be suggestive of PTSD because they are seeing things that they had never seen before. They're seeing family members, friends getting sick, some seeing friends and family members passing away. It has been very difficult for children over the course of the last year and a half. And I have supplied all of you with links that will be, I think, published on the website. And much as my peers have said here, it is so important, it is so vitally important that information that is factual, that is reputable, be supplied to the general public about all of the aforementioned topics and about mental health and what is in fact going on the ground, and what are certain outcomes, what could happen if, for example, someone is wearing a mask, and what are the effects of mask wearing and social development or emotional development or whatever the case may be. I was reading an article, or I was doing some reading just this last Sunday in preparation for this presentation. And I just so happened to come across an article in the New York Times, and it was an opinion piece written by Judith Danovich. She is a professor of psychology out of the University of Louisville in Kentucky. And she wrote a piece about how the effects of mask wearing that have been talked about with respect to COVID on children and their emotional development, the negative effects, that is, are not at all what they appear to be. And she broke it down in this article by how, in fact, there could be positive effects for wearing masks. We know that, for example, kids in different cultures where masks are worn by caregivers, they have no worse outcomes in terms of development across multiple domains of development, whether it be cognitive development or social development or emotional development. They have no worse outcomes than their peers from other cultures. And she stated at the end of this article that the positive effects of wearing masks, or at least one positive effect, could be that these children could learn how, or more how to develop empathy and compassion in this day and age, in terms of what's going on now. That is so vitally important, given how much uncertainty there is, especially when it comes to these children who are racked with fear. We, I think, as the adults here in society, we really owe it to the kids to help them with the development of compassion. And I would urge you all to take a look at the New York Times. It was published just this last Sunday. And look for that article, and there will be other links that I think will be on CORE's website. I thank you for your time this evening.
All right, thank you. We're going to move now into the question and answer period. Thank you all very much for your presentations. I very much appreciate it. I have, the first time I took my mask off, I took my microphone off, so if you'll bear with me, I'll try to keep social distanced here. But I very much appreciate the presentations. We're going to take the question and answer period, and we have different sections, and we'll have a question for each of you. But the first one for Ms. Holshoe is, how can families with unvaccinated kids best manage engaging in their communities while managing risk? One example comes from this video, video 1.
I really like playing volleyball. Is it okay to play indoor sports during COVID?
So the question was, is it okay to play indoor volleyball?
So I will talk about mostly myself, right? I think that every individual and every family has their own risk tolerance. My risk tolerance, because of what I do, is very, very low. In the last 18 months, I have spent many of my days reviewing hospital records and death records of community members who have been adversely affected by COVID-19, including some of the young individuals that Dr. Myers spoke about. If individuals are playing indoor sports, particularly those who are unvaccinated, my recommendation would be to find a league where masks are being used, as long as physicians are okay with the children being masked while exercising. For me as a parent, I have resisted in having my 4-year-old involved in any indoor activities where he may be around other individuals. Especially when we talk about something like volleyball or anything where you're exerting extra energy and breathing very hard. We know that those are the sorts of activities that cause there to be a lot of viral particles spread into the air. And if I can just take a moment and talk about masks really quickly, because I know there's a lot of misinformation around it. The reason why masks work and work so well is because when we talk or sing or run or laugh or yell, we push respiratory droplets into the air. If you think about when it's cold outside and you're breathing, you see sort of your breath come out, right, when it hits the cold air. That's what happens every time you breathe. You push respiratory droplets out. And the virus, COVID-19, SARS-CoV-2, the virus that causes COVID-19, is inside those respiratory droplets, right? COVID-19, the virus is very, very tiny, but it sits inside these much bigger respiratory droplets. And so when you wear a mask, it actually stops those respiratory droplets from going too far into the air. So it prevents other people from being able to breathe them in. So that is why masks are so effective. So if individuals and unvaccinated individuals and children are running around a court, they're huddling, they're cheering for their teammates, those are all really prime opportunities to be pushing a lot of those respiratory droplets in the air and a lot of virus. And given how infectious Delta is, right now, it's really not advisable for those situations to happen because your children or unvaccinated individuals are at an increased risk for contracting COVID-19. So for me, I would not do that for my child.
Thank you. Thank you very much. All right, let's play the video number 2.
Hi, my name is Craig. When can I get the COVID booster?
Hi, Craig is an adult with special needs and complicated health issues. He lives in a group home and goes to day service. Shouldn't he be able to get the COVID booster now? He received his second vaccination in February.
All right, so the questions for Dr. Hawkinson, there are a lot of questions about who should get boosters, age, medical status, occupation. Who should get those, and can you switch manufacturers when you get a different booster?
Yeah, so a lot of questions in there. So I think we have really good data. We have data from other countries. We have data from Israel. We have data from the United States that shows that, number one, the vaccines continue to be extremely effective at preventing you from seeking medical attention, you from going to the hospital, from going to the ICU and dying. So we need to start there. We have great evidence that continues to show that even this many months out. We also have good evidence to show that efficacy against hospitalization, severe disease, and death may be a little bit reduced from 90+, 95%, down to the high 80s or the high 70s, the low 80s or the high 70s in preventing those major things, hospitalization, severe disease, and death. But in what age group? And we have good evidence to suggest that it's probably in the older age group, the group that is 65 or above or 75 and above. So certainly that is why now we have seen last Friday the Committee on Immunization Practices did go ahead and okay for those people that are 65 to go ahead and get the Pfizer dose, an additional dosing of the Pfizer, so that booster. We are still waiting for further full approval of that or authorization of that additional or third dosing. And they also said other people who are at risk of infection or severe disease. That's pretty vague, but I can have an idea of who that means. Probably diabetes, obesity, heart disease, lung disease, chronic kidney disease, maybe if you're on the dialysis machine. But we are still waiting for the full recommendations for that. And who knows, at some point, if you are over a certain age, 60 or 65 or 70 or 75, your full vaccination status may only occur once you have had 3 doses. So these are questions we don't fully know and understand, but what we do know is that those patients in the older age groups, 65 and above especially, are at risk, a little bit more risk of that hospitalization, severe disease, and death, even after those 2 vaccine doses. We've seen this in the immunosuppressed population, and there is good evidence to support that you need that 3 dose, especially if you are on chemotherapy, if you're on other immunosuppressive drugs, solid organ transplant. So that is where we are sitting right now. We have the recommendation that this group, 65 and older, and others who are at high risk, and again, that's pretty vague, but I expect them to make some details about that, are okay to get additional dosing. But when is it? Is it 6 months out, 8 months out, a year? So far, I think they've landed on that 6 to 8 months. But again, even now, we see that you are still very well protected against hospitalization, severe disease, and death. Certainly, my parents are 71 or 72. So one of them got Pfizer, one of them got Moderna. I did recommend that, when they're able to do it, they are still not at that time frame yet, to go ahead and get additional dosing. In addition, unfortunately or fortunately, we know that anybody can walk into a private clinic or a private pharmacy and really ask to get a vaccine dose, and they can be readily given. We know that has happened. I think it's on the order of 2 to 4 million doses, extra doses have been given to that sort of population that has just walked in. But again, do we need it? I would much rather prefer that the people that haven't gotten any dose of vaccine go get that first dose of vaccine, and then, of course, that second dose. In addition, there was the question, can we mix and match? If you got Pfizer, can you get Moderna? There's no guidance for that except in extenuating circumstances. You certainly can mix and match. It is more than likely very safe, but the guidance is still to get the vaccine dose that you started with. So overall, I think the main answer is going to be, yes, if you're 65 and older, you are probably going to be getting redosed with Pfizer. Soon we are going to have more information about Moderna. Soon we're going to have more information about Johnson & Johnson. But we are still waiting for the full answers to that. But please take home the notion and the comfort that even while you have still gotten the full vaccine doses of either Moderna, Pfizer, or Johnson & Johnson, you are still very well protected against those things we want to protect you against, and that is hospitalization, severe disease, and death.
Thank you. Dr. Myers, I think you've already addressed this a little bit in your opening comments, but the question was if you could comment on Pfizer's report yesterday regarding the vaccine for 5 to 7-year-olds. When do you think, if you brought your crystal ball this morning or this evening, when do you think that the FDA will approve it for emergency use? And then a little bit about, and I'll give a follow-up question so it's not so long.
Okay. So what Pfizer has said is that they will submit the data to the FDA by the end of this month. So either this week or next week, guys, because it's almost the end of September. This is really exciting. It usually takes the FDA, or at least when I say usually, I'm saying usually in COVID times. So when Pfizer submitted their data to the FDA in December, it was a 2-week turnaround to get the EUA. Moderna, same 2-week turnaround. So my hope is that it'll be the same 2-week turnaround. So somewhere in mid-October, but before the end of October, we ought to have the vaccine available for use in those 5 to 11-year-olds. That's what I'm looking at in time frame. The best would be, October 15th, but it might be towards a little bit later in the month, but that would be fantastic.
And again, to reiterate, because I think you did address this some at the beginning, how the disease changed regarding implications. How has the disease changed regarding implications for the younger population and the heightened need for vaccinations for all age groups? How does vaccinating children, I guess, help everybody?
So, there's really good data about this for other diseases too. So I'm going to tell you about some influenza data. So years ago, there was a study done where they looked at only immunizing the children of a community. This was a community up in Canada. And what they found was when you give children influenza vaccine, guess who doesn't get influenza? And grandma and grandpa, more importantly, don't get influenza. It's grandmas and grandpas we're protecting. Not that we don't protect parents too, but grandmas and grandpas are the ones that get really sick and die from influenza generally speaking. So we know that giving kids vaccines prevents disease in their parents, but more importantly, their grandparents and their great aunts and uncles and all of those people that love and care for that child and hug and cuddle and make cookies with them and all of those things. So that's how we know that it's going to be super important to get kids vaccinated, is because we know that vaccinating kids protects adults, just like vaccinating adults in turn protects kids. So for an example, we tell families when they have a young infant at home under 6 months of age who can't get influenza vaccine, all the adults that care for that children, the parents, the grandparents, the aunts and uncles, the older siblings, all of them need to get influenza vaccine because that's what we call cocooning. And we are protecting that very young child who's too young to be vaccinated. So the protection goes both ways. It goes from the adults to the child and back up from the child to the adults.
Dr. Nobles, how will getting children vaccinated help reduce the fear and anxiety that you're seeing and other professionals are seeing for both children and adults?
How?
Yeah.
So fear fits the facts of a situation when we believe that there is a threat to our integrity somehow. And what vaccination does, I think, is it helps us with this fear that there is a threat, or helps us with the thoughts that there is a threat to our integrity. It helps us manage the thought loops that we can get into around being threatened. And if we can advocate or push that out to other people, that sort of information, that, you know, we will not get into these loops around uncertainty, I think that is one way in which vaccinating the general public will help with fear, will help with especially generalized anxiety, the worrying, the chew that we can get into around COVID, especially.
Thank you. All right. Ms. Holshoe, again, questions about how safe it is to gather indoors right now unmasked. You spoke to that a little bit. But specifically with unvaccinated children, I think there's a question from Haley.
My question is it safe to eat lunch in the lunchrooms?
So a question about, is it safe to eat lunch in the lunchrooms? Which, by the way, my kids don't like eating in the lunchroom because they don't like the lunchroom food. But that's a separate issue.
It is, and I know that there are some kids these days who don't particularly like eating lunch at school because of some of the COVID protocols, right? Yep. And each of our school districts does things a little bit differently. Some school districts are still separating kids out. I know that there's some private schools that are putting, beach towels on the floor 6 feet apart, which honestly is the safest thing. Again, when you're talking, eating, those are those opportunities for those respiratory droplets to come out. And so, if you're sitting particularly across from somebody, again, you think about how those respiratory droplets go into the air and how somebody can breathe them in. So if you're sitting face to face with somebody and you're both sitting there chatting and eating, or in a lunchroom eating, those are really prime opportunities for spread to happen. And we've seen that here in Johnson County in certain schools with lunchrooms, snacks in classrooms, all being places where we have seen transmission. And again, I think I'd like to highlight something Dr. Myers said, is that, last year at this time, if we had that happen, maybe it wouldn't be a big deal, at least not as big of a deal, because we weren't seeing the kind of transmission that we're seeing now and the adverse effects in little kids, or in any kids. And the fact that COVID is non-discriminatory. It doesn't care that you have a pre-existing or not. And it seems particularly in kids, and particularly with Delta. And so right now, the safest thing is not to have sort of what we would consider a high-risk opportunity for COVID transmission, and one of those situations is the lunchroom. And I'd also like to say that I'm really not, I feel like a Debbie Downer every time I talk about COVID protocols, because none of it's fun. I don't like telling kids they shouldn't be talking during lunch or they need to be sitting 6 feet away from their friends, but for us right now, while we still have really high transmission here in the metro area, in the US, in Johnson County, these are the ways that we keep our kids safe, and then also our community members safe.
That's right, thank you. And the next kind of follow-up question to that is, what about vaccinated adults who have been fully vaccinated, meeting in groups, and this question says 20 plus. Now, I don't think that's an age, I think that's numbers.
So this is a really good question, and one, we heard from Dr. Hawkinson about the evolving data that we've seen, right? Again, the vaccine is still very, very effective against adverse, really severe illness and death. One of the things that we do know, however, is that vaccinated people can still contract COVID-19 and can spread it. And to dispel some myths, at least the most recent data I've seen, and one of my colleagues can dispute this if they've seen something more recent, is that there's a very high viral load. So the amount of virus that can be found in your nose when you get that swab, if you've ever been tested, there's a very high viral load for vaccinated individuals. And so that means that they can transmit it, but that viral load drops off. So you're not spreading the disease for as long if you're vaccinated. So with that being said, I think a lot of it goes to risk level. Again, I talk about this a lot. For me, as a parent of an unvaccinated 4-year-old, I would not be in a crowd of 20 plus people, even if everybody was vaccinated, because for me, my fear is bringing it home to my unvaccinated child. If you have severe underlying comorbidities, particularly some of the ones that Dr. Hawkinson mentioned, where you are already at an increased risk for COVID-19 and severe outcomes, you maybe want to consider something else, maybe not going, maybe having everybody mask. You can have 20 plus people in a room masked and be really quite safe. For me, the thing that I do is I still have a bit of a pod, again, with an unvaccinated 4-year-old. So when I am with people who are unmasked, I understand how they act in the community. I know that they are masked when they're going out. I know that they're not eating inside restaurants. And so I know that their risk of having COVID-19 and then being able to transmit it to me, and then my ability to transmit it to my child is then reduced. So it's all about sort of that level of risk and your own situation. And so particularly around if you are vaccinated, just being aware of who you could then transmit it to or what the outcomes may be for yourself.
That's great, thank you. Dr. Hawkinson, if you've already had COVID, there seems to be a lot of confusion. I guess this is one of the themes tonight. There's a lot of confusion. But if you've already had COVID, there's a lot of confusion about natural immunity, how long it lasts, and should you get vaccinated, and what are those health risks?
What was the last part?
And what are those health risks? If you've already had it, is there a risk of getting vaccinated?
So if you've already had it, there is no risk of getting vaccinated. In fact, the guidance is to get vaccinated. And why is that? Well, early on, again, pre-Delta, really pre-Alpha, we saw that reinfection was rare. But yet we still had cases where people would have less symptoms and do better, or have worse symptoms and have even worse outcomes like death. But our biggest thinking was that reinfection was rare. However, you have to take into account what is that person's behavior. If they are out in large group gatherings or parties, they are going to have more chance to be re-exposed to the virus. So we don't really know what happens. And certainly if you had infection prior to the new year or prior to Delta and now you get Delta, you are not going to have those specific antibodies to help you against Delta. You'll still have some cross-reactive antibodies. But really the main guidance is that if you were infected, you should get vaccinated. In fact, what they have shown, and the data is pretty good about this and continuing to evolve, but what it showed is those people who had infection with any type, whether it was the typical or the first Wuhan lineage or strain, or any of the other variants, if you were infected, you recovered, and then you got at least one dose of the mRNA vaccines, you seem to have a more robust immune response. After the 2 doses, it's about the same, but it is still much higher than even those that had 2 of the mRNA vaccine doses. Why is that? We don't really know, but what we have seen is that those areas in your lymph nodes, or what they're called germinal center, those areas where the B cells are living and they are maturing, and those T cells, where those T cells are expanding, those seem to last longer in the lymph nodes to continue to mature. It's almost like our own body's mutation mechanisms, because even before vaccines, we were able to see viruses, and we knew viruses would change, our immune system did. But with the vaccines, what that does is that is able to expand and create a more robust immune response, in that your B cells now are creating more antibodies to variants that you haven't even seen yet. And your T cells are able to recognize these variants that you haven't even seen yet. And so it is certainly a lot better to get vaccinated after getting infected than just natural immunity, especially now that we know the variants are here. We know that there are going to be more variants. It's just a matter of when. So the main answer is, yeah, you should still get vaccinated after infection. And what we have seen is that your immune response to all of the circulating variants is much greater than you had just with natural infection alone.
Thank you. Okay, Dr. Myers, young mothers have had a lot of questions that have come in, so here's one.
Question is it safe for pregnant women and nursing women to get the vaccine?
Oh, I love this question. Oh, what a cute baby, too. Okay, so the short answer is yes, but let me tell you a little bit about that. So the COVID vaccine has been studied in pregnant women ever since it came out. So while there weren't intentionally pregnant women in the clinical trials, as there generally aren't, there were some women who became pregnant while they were on the clinical trial, and so there was some early data there. Then once the vaccine became available for healthcare workers in December, there were many healthcare workers that got vaccinated who were pregnant, and those people were followed forward in time to the tune of more than 30,000 of them. And now more and more studies have been done and have come out, and we have learned several things. Number one, if you are pregnant and you get the vaccine, you pass the antibody to your unborn child, which is wonderful. Number two, if you get pregnant and have the vaccine, you are not more likely to have any problems with your baby, with the pregnancy, with the delivery. But if you get infected and you are not vaccinated, you are far more likely to deliver the baby preterm, and that baby is more likely to have problems. And we have seen babies in our NICU that were born too early and have had a lot of health problems in moms who have COVID disease, okay? So COVID vaccine is protective. It protects mom, it protects the unborn baby, and when the baby is born, they have some antibody. Number two, when a mom gets vaccine and is breastfeeding, she does pass some antibodies to the baby. Those are IgA antibodies, which are secretory antibodies, which are the antibodies that live in our mouth and through our entire GI tract. Those are the antibodies that protect our GI tract versus the kind of antibody you get from a vaccination. So it's really helpful for both mom and baby. And those IgE antibodies do provide some protection to the breastfeeding infant. And so all of this kind of fear-mongering that has been out there on the internet and has been on social media platforms in different places, none of it is true. None of it is true about fertility issues or anything of that nature whatsoever. Although there is data in men that having COVID infection can cause problems with sperm. So once again, infection is really the problem here, and vaccine really is safe and protective and has no bad effects on fertility, pregnancies, or breastfeeding.
Thank you. That was very clear. Thank you. This is, I don't know about you all, but aren't these questions we see on the news every day? This is fantastic, so this is great. All right, let's keep going. Dr. Nobles, how can a parent help their child through bullying regarding mask wearing? And this is the saddest question for me of the night. Bullying for mask wearing. For example, children who go to school without mask requirements but still want to wear one.
This is a really sad question. And I think that the best way to help with bullying, I think there are still the standard tried and true ways of helping kids with bullying. Having a good relationship, parents having a good relationship with the school is a really important factor when it comes to helping a kid with bullying. Having a really loving home environment with the kid, having a really good relationship with the child. So not only is the home environment loving, but having like a good relationship. And I think that those can be two different things. I think that making sure that the kid has support with peers, and it could be inside of the school, it could be outside of the school, so long that the child has some sort of support network, making sure that the child knows what to do in the event that that bullying occurs, and that depends on developmental levels. So making sure that a younger kid knows exactly what to do in terms of talking to a teacher. An older kid can engage with a student differently or engage with a peer differently. Parents can talk to kids about how they might engage with with someone who's a peer, and if there's physical intimidation or anything like that, making sure that indeed an adult gets involved, because you do not want to have physical altercations or anything like that going on. That's a really sad situation. I've heard a bit about that going on, even with the kids who have come in to see me. You do see it in the high schools, and it's very unfortunate, but those are just some of the things that I think that you can do. And if there are some systemic things that you can try to accomplish with all of this, having the school board on board with you, having the superintendent's office involved, those can be some extra things that can be done too. And that takes a bit more legwork. That takes a lot more effort on the part of the parent to have those resources involved. But I think on the ground level, it's having conversations with kids about what exactly has happened and having a really good relationship with the child and making sure that the environment at home is a good and safe one for them.
Thank you. All right, this is our last official round of questions. Then we have some more after this, but for the last formal round. Ms. Holshoe, if a school is experiencing positive cases, at what point is there a need for classes to shut down?
Oh, I'm getting the tough ones and the not fun ones. I want to talk about breastfeeding moms and vaccines and cute babies. That sounds more fun. So this is a really difficult question. I've been asked this a number of times throughout the last school year and this school year, is what is that line? And it's hard, right? We know, and I said this in my opening comments, that we know the best place for kids is in school. For a variety of reasons. You know, some of the base needs are sometimes only met in those school buildings, from a trusted adult to lunch and breakfast. We know that when we send kids home, particularly younger children, parents maybe can't work. They may be at risk of losing a paycheck or a job, maybe not being able to pay for the mortgage or the rent on their house or putting food on the table. These are all very real ramifications that come along with closing down classrooms, closing down schools, having kids at home for virtual learning. So it's a really fine balance. You know, our goal, the Johnson County Department of Health and Environment's goal that we set out before the school year last year, was we believed we could keep kids in school safely with mitigation measures. And as long as we could do that safely without putting their health at risk, that's what we wanted to do. And so at this point, we know how to do that safely with masks. You know, there was a lot of questions last year about how close could kids be? If we took away that distancing but kept kids in masks, could we still keep them in school safely? And at least with the original virus that was circulating last year, and even with Alpha, we showed that we could. This year, we are continuing to see really good data out of our schools that have implemented these mitigation measures. Rarely have we seen a classroom-based outbreak where kids are masking consistently, even when there's no distance between them, right? So even when they can't be 3 or 6 feet apart. But it's a hard question when we, particularly in our schools that are not implementing these measures. Those are the schools where we tend to see outbreaks and a lot of transmission. And so, unfortunately, I don't really have a good answer. We don't have a hard and fast line. We at Johnson County, at least, try to do very targeted exclusions. Again, understanding that we want to keep kids in school, but keep them in school safely. So if we have a positive in a classroom, we want to just send home those kids who we know are at highest risk of contracting COVID-19. So if those individuals are unmasked, the ones who sat around them, not the whole classroom. So we at Johnson County take every school, every case on a case-by-case basis and work with our school nurses and our school buildings and principals to be very selective in excluding kids. So I don't really have a number, but know that we are doing everything we can to keep kids in school and keep them healthy.
Thank you. Dr. Hawkinson, another big question that I think a lot of people have. Families are concerned about how strained our hospital systems are and hindering access for people with other illnesses. And I think we have a video question for this.
I know that COVID hospitalizations are reaching extremely high levels again. How will the hospitals be able to care for all their other types of patients, including emergencies, with so much of their resources directed to COVID?
Yeah, you know, that is a real scenario, a real situation, and a real question. We have seen that happen. Now, I think that overall, I'm still going to say that we have been extremely lucky here in our community. Even Omaha has been lucky, but we have seen what has happened to other larger communities, but also other smaller communities like Springfield. We saw that happen. We saw that communities around there in those critical access hospitals, they were unable to care for quote unquote routine or other pre-pandemic medical issues. We have been very lucky here in the Kansas City metro area with University of Kansas Health System, but also with our neighboring hospitals as well. We haven't really run into that problem. What seems to be more of a problem is the fact that we don't have enough people to staff those beds, and that is a very real issue as well. Nursing, respiratory therapists, because we can have all the open beds and have space for them, but who is going to care for them? Because it's those nurses and those respiratory therapists and the other therapists who continue to work with those patients minute by minute. And so that's very important too. It's not just about those critical pieces of hardware like ventilators, those critical drugs like the drugs to keep you comfortable if you have to go on the ventilators. But it is the critical people who are doing it every day, who are by your side and working with you. And so that continues to be a very real issue as well. We have been very lucky here, but we know that overall the hospitals are strained more because of the workforce rather than PPE or critical drugs. So, how will we do this? But this is not just isolated to the healthcare professions. 2020 was really shut down and everything was shut down. 2021 has been work shortages. They're short staffed. There just have not been enough people to do that. What is that? For one reason or another, certainly what we see in the healthcare business, it's due to burnout. Burnout is a huge thing, and it's continuing to try and do the right thing and caring for these people day in, day out. But it's also, there are other places that, again, as I said, are much more worse off than us. They are paying higher premiums for those people to go work there as well, doing the travel, nursing, and things of that nature. So there is a lot of confounders, a lot of different variables in this, but I think we are always ready and prepared for capacity issues, and whether that's ventilators or vital drugs. That's a lot easier to prepare for, though, however, compared to workforce shortages. So we are certainly concerned with that, and we are seeing that all around our metro area, and I think a lot of regions around the United States right now. And again, the way to continue to get out of this is, we know it works, the non-pharmaceutical interventions. Do those things, the masking, the distancing, be outdoors where there's good ventilation in those times that you can do it. But most importantly is continuing to endorse vaccination and continuing to get people vaccinated.
Thank you. Dr. Myers, are there any health risks that parents should be worried about when kids wear a mask for too long? For example, a kid who goes to school all day from 8:30 to 3:30, and then again for evening activities from 5 to 7:30.
Yeah, that's a great question, and that's been brought up a lot of in a lot of places, a lot of different venues, and people have been concerned about that and have talked about that. And the data has shown us that kids are safe wearing masks all day long and even at their activities. It doesn't hurt their development. It doesn't hurt their socialization. And in many countries, even pre-pandemic, especially some of our Asian countries, they were wearing masks long before we were during the winter season and when there was big respiratory viral outbreaks. Kids grew up wearing them. In fact, there was a really good New York Times opinion piece from a Japanese American woman about that very thing and how proud she was as a child to wear her mask and know that she was protecting her community. It was really well done. But people continue to bring that up, and it just isn't true. So I would just remind everybody that when Dr. Hawkinson was just talking about, when we in the healthcare setting are caring for children who are sick with COVID-19 or adults who are sick with COVID-19, we are wearing these masks for 12, 14, sometimes 16 hours a day. There is no risk to wearing a mask. There is no risk to breathing in too much CO2 or not having enough oxygen. And there's no risk for children either.
And if I could just interject too, not only for the children, but for the adults, in my infectious disease practice, who did we not see? And as far as published data, what are we not seeing? We aren't seeing people with random pneumonias or increased infections in their lung because they are wearing masks. We actually saw a reduction in those types of things, those type of respiratory infections because of the masking. We did not ever see any increase in those unusual infections or those pneumonias. And so I think that just kind of is one more data point to show that masks are safe.
I can add a funny story to that too. My cousin Russ is a physical therapist at Providence Hospital and has been there almost 30 years. And he was telling me that he was at home cooking dinner and was cooking everything and putting everything together. And he went to take a bite of what he was preparing. And he was still wearing his mask. That he had been wearing his mask so much. I mean, he wears it all the time at work, every day in the hospital, that it's become so ubiquitous to him that he didn't even realize it when he went to take a bite of his own dinner. He's like, my gosh, it's 8 o'clock at night. I have to get this thing off. So we're all running into a new normal in terms of how we handle this. Dr. Nobles, frustrations are high among those who are vaccinated and following the guidelines of health experts. How do we come together to move past this disease with all the frustration that we're facing towards one another? I could save the easiest question for you.
Well, I had better not botch this one. Anger, and I'll go back to something that I had said earlier. So I talked about how fear can fit a situation when we feel threatened. Anger, so frustration or irritation, kind of fits a situation typically when we feel like our goals are being blocked in some way, or when we feel like we've been insulted in some way, shape, or form, or when we believe that our dignity has been insulted or degraded, our social status has been degraded. And I think that in order to reduce frustration, there has to be kind of a stepping away from the situation so that there can be perspective taken and then a reapproach to a situation. Now, that is much easier said than done in this day and age and with this particular topic. And I think that with social media as an example, that makes it really difficult to take a step back for a great deal of us. And with this particular topic, there, as I think it has been discussed, and I cannot reiterate this enough, there has been so much misinformation or even disinformation that has been put forward. It's really difficult to kind of sort through all of that and kind of take good perspective and then come back to the table with information that that's really that's really good to have a fruitful discussion over. But I would encourage people to really take a hard step back and try and cool off a bit. And I would encourage people to seek out information that is reputable. I would encourage people to have folks like these on the ready, if at all possible, or have information sources, or be able to get access to information sources breaking out of information loops that we may be in or may not be in, doing the best that we can so that we can be able to meet somewhere where there are facts. I think that's really, really important. And that way we can have dialogue. And if we can show that to the children, if we can model that, I think that is a way in which the kids, the teenagers, can engage. That's a way in which the children can engage. And that kind of gets back to what I was talking a little bit about in my remarks earlier about compassion. I think that we've got to start with taking a little bit of time away from arguing, just taking a step back. I think that's one way. It may not be the best way, but I think it's one way.
Thank you very much. Okay, I have a couple of quick questions before we start to wrap up. For Dr. Myers, how many vaccines are already required for children to go to school?
Man, that's a hard one. Okay, so you're gonna count with me here because this is a really unfair question. There's 3 Hep B, there's 2 MMRs, there's 2 varicellas, there are 3 polios, there are 5 DTaps, and depending on which Hib you get, it's either 2 or 3, 2 rotavirus, and, well, although Hep A is not required for school, 2 Hep A's. What am I missing?
I think depending on the series, it can be 16 shots by the time they get into.
See, she's so much better than I am because she's thinking of the combinations, and I'm totally just thinking about what they protect against.
Yeah, it is a lot.
It's a lot, but I will tell you this, and I learned this not that long ago, but I love this. Okay, so way back, when smallpox was a problem in our country, there was a vaccine for it. There was vaccine hesitancy even way back then, and 200 years ago. That vaccine was by today's standard, a very rudimentary vaccine and had a whole lot of impurities and antigens in it, which produced good immunity and prevented smallpox, but was not the best of overall vaccines. If you look at all the vaccines we get today for our entire lives, including the ones that we get as a teenager, we get HPV, we get meningococcal, we get a booster of tetanus with your pertussis booster, plus all the ones you get as an adult, including your shingles shot and your pneumococcal shot to prevent pneumonia as you age. That isn't even coming close to the number of antigens that were in that original 1 smallpox vaccine. Because what we've done with science is we've been able to target the most important proteins of these bacteria, of these viruses that cause disease, and pull them out and make them into a vaccine that will induce the best immune response to the body. We only use the most important ones. We don't use the whole thing anymore because we don't have to, because we have the science and the ability to just use what we need to induce that immune response. And so it's really critical to understand that we have come so far in the development of vaccines over the last 200 years, and they're just so much better than they used to be.
Thank you. All right, I want to first give a big round of applause to our panel. thank you so much for taking an evening away from your families to talk about what you do every day. And the COVID fatigue continues, but thank you for sharing your knowledge with us tonight. And thank all of you for being here, and for Church of the Resurrection for hosting this again for the United Methodist Women. I believe we have one last question.
How does our faith help inform the decisions we make around the vaccine and mask wearing?
All right, so I think this one's for me, about how our faith helps us understand the vaccines and the mask wearing. There are a lot of scriptures that I could point to, starting with the 10 Commandments and honor your mother and father. One of the reasons I got my vaccination first, it wasn't out of fear. It was out of concern for my 80-year-old parents, and a concern that they not get it because they're at a much higher risk than me. And I am at risk, and so I also got it because I have children who ought to have their dad around for the long haul, even though they're teenagers and not sure that's as important as I do. So I think concern for family is one. But as Christians, we're not, Jesus says even some harsh words that even thieves love their own families. Even thieves love their own families. He calls us to a higher calling. And when he was asked, what's the greatest commandment? He said to love the Lord your God, first and foremost, with your mind, soul, and strength, and to love your neighbor as yourself. He didn't say it's enough to love your family. It's enough to love your neighbor. And we have a calling as Christians, I believe, to be concerned about the least, the last, and the lost. I don't know who's immunocompromised out there. I don't know if I'm carrying. I know I can wear a mask that if I'm carrying, I'm not going to pass it on to someone accidentally. I had someone tell me one time, well, everyone has a chance to wear a mask themselves and to get vaccinated. Isn't it on them if I give it to them? That's not Jesus speaking. I'll just go out on a limb. That we have a Christian responsibility not to just care for ourselves and our family, but to care for our neighbor. Now, Jesus makes it even harder because he says, not only do you need to love your mother and father, and not only do you need to love your neighbor as yourself, he says you really have to tolerate your enemies. But he didn't say tolerate. He said you have to love your enemies. Now, I don't think folks who disagree with us politically are our enemies, but it is true, by getting the vaccine, you could save a member of the other political party. And that would be doing Jesus' work. So the idea that we're all in this for ourselves, that I have a right to my personal freedom. Yes, I believe in personal freedom as well. I believe God believes in personal freedom. That's why we have it. I also believe those of us who call Jesus Lord have an opportunity to care for others, and a mandate to care for others, and have a concern for others, and to do our part. And if getting the vaccine does my part, it's a great gift. I once had another young family when our children were young, and they were sharing pacifiers, right? You know, and this is true with the first kid, and I apologize, but with the first kid, you know, the pacifier falls on the ground and you sterilize it, you boil it, you clean it, you get another one out of it's all clean. The second kid, you rinse it. The third kid, you're like, so granted we go downhill as parents over time, right? But I think this, I was having a discussion with another family, and he said, well, I'm not going to get any of the vaccines for my kids. We're going to homeschool them, and I'm not going to vaccinate them. And I said, well, why not? And he said, well, because there's a higher risk of getting the diseases from the vaccines than from the world. And I said, one, I think your first statement is completely false. But two, the reason you're not going to get it is because I gave it to my kids, right? It's called herd immunity. It's about the group. It's about loving one another. It's about caring enough about other people's children to have my children vaccinated. It's not, I just go out on a limb for Jesus. It's not about you. It's about all of us. And I think the mandate for vaccines and masks is about loving our neighbor and even loving our enemies and doing what we can. I'll close with this. One of the things in the first commandment, before Jesus even talks about loving our neighbor, is Jesus says to love the Lord your God with what? With your heart. I agree with that. With your body. I agree with that. With your mind. Humans are unique in our ability to think and to not only think, but to share knowledge. I'm not the smartest person in the world, but I know smart people, right? I have a wonderful dentist, and she knows all I need to know about teeth. I don't have to do my own research. I go ask my dentist. When my car breaks, though I love my dentist, and though she may have a secret hobby working on cars, though I doubt it, I ask a car mechanic, right? I want to hear from an expert in cars. And if I'm not sure if I'm getting the right information, I'm not going to say, okay, my car mechanic's not telling me the truth. I'm going to go ask my dentist. No, I go ask another car mechanic, right? Where if I'm getting a second opinion, I'm getting a second opinion in the field. If I have a loved one with cancer, I think my mechanic's pretty good, but I'm going to talk to a doctor. And I'm not going to talk to any doctor. I'm probably going to talk to a doctor who specializes in that kind of cancer. And if I need a second opinion, I'm going to talk to another doctor who specializes in that kind of cancer, right? There's some attack on professionals right now, on experts, people who study the field. You can do all your own research every single day and not have the amount of experience that these 4 persons have. And not only the experience they individually have, but they collectively have with the medical community that's doing research together on behalf of all of us. So since we're here at the United Methodist Church, and I'm a United Methodist pastor, I'll just close with John Wesley's words. One of John Wesley's beliefs as he founded Methodism was that the knowledge and the heart of the faith go together. And he had this phrase that he said one of his goals was to unite the two so long disjoined, knowledge and vital piety. Friends, as Christians, we do not need to choose between science and faith. God has given us the mind. God has given us those who have spent their time learning about different fields, and we learn. And if every doctor at every hospital in the metro area has taken the vaccination, has given it to their family, is looking forward to giving it to their children, that's all the research I need to do. And I think it's time that as people of faith, we not only take the vaccine and we wear our masks for ourselves and for others, but we also advocate for those and say to our family members and to our coworkers and others, you know what, I hope you'll make that decision too. And I think we have an opportunity as Christians to witness to others that taking it is not out of fear, it's out of a faithful response to what the world needs most from us right now. So I hope that that's a message that we can take away, because I don't think it's a decision between Christianity and science. And if I might, I'd ask us to close with a word of prayer. Will you pray with me? Good and gracious God, we thank you so much for the expertise on this stage, for sharing their life work for health in our communities. And Lord, we thank you for all of those practicing medicine who are sharing their knowledge and their gifts with all of us, and especially those who have given their lives serving those with COVID-19. Lord, we ask that you will pour out your grace upon us, pour out your hope and your knowledge, that we might share with others the gift the gift of medicine that you have given us, and the opportunity for good health for our families, for ourselves, for our schools, our churches, and for our broken nation. Lord, we cannot abide political divisions getting in the way of healing. And so, Lord, we turn this over to you with grace and with thanksgiving, and we'll be careful to give you the honor and the glory. In Jesus' name we pray. Amen. Thank you all very much.